So I'm just connecting us to YouTube in the background, and we'll be going live shortly. And then we'll get started. All right, we're streaming live, so if everyone's ready to go, we can get started. So today is Tuesday, May 19th. Thank you for joining us at another media briefing. And thanks for remembering that yesterday's briefing was canceled and it's actually today. And we'll also have one again on Friday. So we have statements today from Acting Medical Officer of Health, Dr. Hsiu-Li Wang, as well as a statement from Regional Chair Karen Redman. We also have Mike Murray here, our CAO, who will answer any questions as needed. So without further ado, I will pass it over to Dr. Wang. Go ahead, Hsiu-Li.
Good morning. So sadly, we continue to see COVID-19 deaths in our community. To date, 111 people have died. I wish to express again my deepest condolences to all the families, friends, and caregivers who have lost loved ones to COVID-19. Among our 111 deaths, 20 are from the community and 91 are associated with outbreaks. Currently, there are 13 long-term care or retirement homes in outbreak, and 21 long-term care and retirement homes have had their outbreak declared over. 673 persons are now classified as resolved. I was somewhat disappointed to hear of examples of residents not following physical distancing measures over the long weekend. Yes, it was a long weekend, the unofficial beginning of summer. And yes, we had some nicer weather at the beginning of the weekend. But we can't undo the good work that has gone into slowing the spread of COVID-19 in our region. I realize that we've been asking residents to stay home for some time now. And I fully understand that as restrictions are lifted, people are eager to be outside and begin doing some of the things they haven't been able to do for weeks. But we cannot go back to the normal. We have to go to the new normal. And physical distancing is at the foundation of this new normal. This point becomes more important than ever as more places begin to reopen this week. Due to the fact that we are seeing more and more people together and not always physical distancing, I recommend that in places where there are other people, residents wear non-medical masks, such as cloth masks and face coverings if they can. So I repeat that it is critical for residents to continue to practice measures such as physical distancing to strongly guard against a rapid resurgence of COVID-19 in our community. Please remember that testing, which is now open to anyone in our community with symptoms of COVID-19, is a tool used to help us identify cases. It does not prevent transmission from occurring in the first place. The tools of primary prevention, such as preventing infection in the first place, are our best defense against COVID-19. Last week, a report on testing across Ontario characterized Waterloo region as having a low rate of testing. The report indicated that as of April 30th, Waterloo region had completed 5,198 tests, a rate of 871 per 100,000. On that same date, our records indicate that 7,790 tests were completed in Waterloo region at a rate of 1,288 per 100,000. So this is not an insignificant difference. We understand that the ISIS study used a lab database called OLIS to arrive at their numbers. Not all labs are reporting into OLIS or did not start until later on. We understand some labs which may not be submitting into OLIS or may have started submitting later on have processed a significant amount of our samples. We are in the process of trying to understand from those who oversee the lab system which labs reported into OLIS and when, and how many specimens submitted from our region ended up in OLIS. We cannot say for sure which labs our specimens were analyzed at either because of the rerouting that can occur. So we are also trying to find answers to that. So we're still looking into it with Public Health Ontario Lab and ISIS. The most important thing is we've opened up testing to all persons who have symptoms of COVID-19, and we encourage all those who are eligible for testing to be tested. So I'd like to remind everyone that all residents with symptoms of COVID-19 are now eligible for testing. There are 4 assessment and testing locations in Waterloo region. Last week, I mentioned there are 5 because the 2 Cambridge clinics are at the same location, Cambridge Memorial Hospital. For simplicity going forward, we are now referring to them together as the Cambridge North Dumfries Community Assessment Center, located at Cambridge Memorial Hospital. Residents experiencing symptoms are encouraged to use the self-assessment tool to determine if they need to seek further care or testing. This tool can be found on our website or also at covid19checkup.ca. The tool can connect individuals experiencing symptoms with a primary care provider for a virtual assessment, who can then make a referral to one of the assessment and testing centers. Individuals are also now able to make self-referrals to 3 of the 4 sites, those located at our local hospitals. In closing, please continue to limit the amount of times you go out. When you do go out, please practice the following measures. Continue to only spend time with your household contacts. Do not gather in groups of more than 5. Keep 2 meters or 6 feet between yourself and others when you do go out. In places where there are other people, wear non-medical masks, such as cloth masks and face coverings if you can, and continue to wash your hands often. Thank you.
Thanks, Hsiu-Li. I will pass it over to Chair Redman. Go ahead, Karen.
Thanks, Bethany. Today marks the beginning of the province's first phase of recovery, and this includes an expanded list of businesses that are permitted to open today, including many in Waterloo region. This is possible because of the commitment residents have made to physical distancing and staying home as much as possible, and I thank you for your efforts. At the region of Waterloo, we're working hard on our back to business plans. Although most of our services have continued throughout the last few months, we're eager to reopen some programs that have been put on hold due to COVID-19. One example that I'm excited about is allowing curbside pickup at our rural library branches, which we hope to begin in early June. Going forward, I want to impress upon everyone to stay vigilant and stay apart as much as possible. As businesses open up, the risk of flare-ups is real. So we need to take a slow and continue to follow public health advice. As you visit businesses, parks, and other public places, continue to stay 2 meters apart. Wear non-medical masks or face coverings, wash your hands, and don't gather in groups over 5. The last thing we want to see is an increase in the cases in our region as a result of loosening up restrictions. The gains that we have seen locally can easily be lost if we're not careful. Thank you for doing your part.
Thanks, Karen. Okay, we can move over to media questions, and let's start with Ben from 570. Go ahead, Ben.
Hi, good morning. Hope you're doing well. So I think this is a question for Dr. Wang. We were at 112 deaths on the dashboard for a few days. So today we're down to 111. Is that a counting error or what happened there?
Yes. Thank you, Ben, for your question. There was one individual who was mistakenly noted as deceased when in fact they were not. And so that has been corrected as of this morning's refresh. Thank you.
Thank you very much. Can you touch on which of those, what are the 3 locations where patients can go to get tested for self-referral?
Yes. So at the St. Mary's General Hospital site, at the Grand River Hospital site, and at Cambridge Memorial Hospital. So you can find those locations and the numbers for self-referral on our website, as well as on their websites. It's under a community, it's under the Assessment and Testing Center's webpage.
Okay, I was just looking at, because I know we got an email from Grand River Hospital over the weekend, and they said they were going to assess they said they were opening it just for the Saturday and Sunday of the long weekend, then they were going to reassess. And on Grand River's website, it still says it's only for healthcare workers and first responders. So that's not the case. It's now by self-referral for all residents?
Yes, so what I understand from the hospitals as of last evening is that they're continuing to accept self-referrals.
Okay, thank you very much. Just one more question then. I'm just wondering about, as far as our testing rate goes, when could we expect, or can we expect, to increase testing to those who have come in prolonged contact with positive cases?
So testing is available for those who develop symptoms of COVID-19. That is the provincial guidance, and that's what's being applied here. So, you know, testing rates are going to depend a lot on people coming in for testing. So we really want to encourage that anyone who has symptoms of COVID-19, and they can do the self-assessment via the tool on our website to determine if they have those symptoms. So we really encourage that anyone who has symptoms of COVID-19, you know, seek medical attention, or they can also self-refer to one of those 3 clinics. But we really encourage them to get tested.
Okay, thank you.
Thanks, Ben. Okay, I will pass it over to Damon from the Woolwich Observer. Go ahead, Damon.
Good morning. To start off, I was just wondering if Dr. Wang could give us an update on the cases at Conestoga Meatpackers in Breslau.
So the numbers that we have on our website are the latest numbers that that we have and that we have provided to Conestoga Meats. So there hasn't really been a change in terms of our overall assessment. You know, we expected that more tests would be coming in, but the important thing is as we receive those results, we continue to assess. Conestoga Meats, as you're aware, has a number of cases for which it's likely that they were not acquired at the plant itself, in addition to some cases that were likely acquired at the plant. And what we've seen after having really referred a number of people to testing is that we've seen a large number of positive cases come in, and now we're seeing a slowdown in those positive cases. So that's a good sign. That said, we'll continue to monitor.
Okay, great. My next question is just for Mike Murray. I was just wondering about over the long weekend if you've seen an influx in regulation breaking and if you could give us those updates.
Thanks for the question, Damon. So I don't have all of the stats that I often share on our Wednesday calls, and I'll hope to have that by Friday, the whole comprehensive update. But I'll just give you an overview that I got from our enforcement folks this morning. So public health, police, regional bylaw, and area municipal bylaw did have officers out over the weekend. They had 200 or more site visits. So that would be either a combination of complaints or proactive patrols conducted over the weekend. Most of those were on Saturday. No charges were laid over the weekend. We did, as Dr. Wang noted, we did see more complaints of gatherings of more than 5 people. And so a lot of the activity, the compliance enforcement activity was responding to complaints about that and doing education and awareness and reminding people about the emergency orders.
Okay, great. And then for Dr. Wang, the increase that we're talking about on Friday, the estimated, I think it was 3,000. Is this as reflective as it's going to be, or do we expect to continue influx through these numbers?
No, all the corrections have been made now.
Okay, perfect. Thank you for your time.
Thanks.
Thank you, Damon. I will pass it over to Joanna from the record. Go ahead, Joanna.
Great, thanks. This question was kind of asked already, but just about the self-referral for testing. There seemed to be over the weekend, things changed a bit and the hospital said that it would only be for the weekend. Were you guys involved with that, or do you know like what happened and why that was done or said?
So the information we have is the information that's provided to us from the testing sites. So I would refer you back to the testing sites for that particular question about the weekend. I understand that, you know, it was the first weekend that we had opened up testing, and so you know, the sites who really, you know, do want to expand testing as much as possible wanted to make sure that they would have the ability to continue with that. So it's possible, you know, they may make some adjustments to what they're able to do, and it's possible too that we're not necessarily going to be immediately informed, just because, you know, they might make some operational adjustments first, and then we've asked them to keep us informed. So yeah, so for example, Cambridge Memorial Hospital on Saturday informed the public that they were also now accepting self-referrals. So that was a bit of a difference as well from my briefing Friday, based on the information I had just before my briefing. So I think there's likely going to be a little bit of a period of adjustment, just because it's new. And but I do know that you know, our partners who do the testing, they are very much wanting to try to you know, expand access to testing.
All right, those were my questions. Thanks.
Thanks, Joanna. I will pass it over to Nicole from CTV. Go ahead, Nicole.
Thank you. Good morning. I'm not sure who can answer this question, but a GRT driver tested positive for COVID-19. Why did the region not proactively let the public know about the driver's positive status? Because in Toronto, for example, the TTC lets the public know whenever someone within that organization tests positive.
So I'll refer that question to Mike Murray.
Yep. So Yeah, so overall, I think you're aware of the measures that we've taken to ensure that transit is safe for our operators and is safe for our customers. And so our view is and continues to be that the measures we've put in place protect our operators, protect our customers. When we found the operator tested positive, he has been off and will be off for another few days. But as I said, I think the measures we put in place, the rear door boarding, it keeps space between the operators and the customers. We've blocked off the whole front of the bus. That keeps more space between the operators and the customers. And as I said, it was both to protect the operators and to protect the customers. So we think that everybody was adequately and safely protected. And I would also just reinforce some of the other measures that we've put in place to make sure that the transit system is safe. Asking our operators to follow physical distancing advice, enhanced cleaning and disinfecting on all the buses, trains, and stations. Operators having the option to wear their own masks. Anyway, as I said, we think it's safe both for customers and operators.
But why not let the public know that a driver had tested positive?
Yeah, we don't think that would have added any value in terms of additional, safety for either operators or the traveling public.
Hold on, I just have to scroll down. Give me 1 minute here. We've heard from some GRT employees who are concerned about the frequency that buses are being cleaned. They say it's not enough, and that they're concerned about the number of passengers on the bus, and they're worried that not all buses have the protective screens or will be in place by June 1st. What is your response to that?
Well, yeah, overall, as I've said before, we're committed to making sure that transit is safe for our operators and safe for our customers. So we'll do everything that we need to make sure that that's the case. We're working hard to get the plexiglass screens installed before we go in back to front door boarding. So that's our commitment on that. We're working closely with the Joint Health and Safety Committee to make sure that the union is appropriately involved, and that our corporate health and safety and the Joint Health and Safety Committee are fully involved in all the activities to make sure that transit is safe. So there's a lot going on, engaging the bargaining unit, engaging health and safety, and trying to make sure that the transit's safe.
My next question, I think, is for Karen. On Friday, you said that you have no information about summer camps in the region for this summer, but on Friday, Toronto went ahead and canceled all camps there. Is Waterloo Region planning to follow suit?
So the camps are conducted by a lot of our partners. A lot of the area municipalities are the places where summer camps are offered, as well as I think of the Ys. So at this juncture, we're still monitoring it, and there has been no decision made at this point in time. And I recognize this is something that a lot of parents of young children are thinking about when we look back at, look forward to a new normal and getting back to work. So right now, Nicole, there's nothing to report, but these are decisions municipalities will make. To date, the area municipalities have all moved in sync and certainly in coordination with the region, but we haven't always done all the same things that the City of Toronto or any other municipality has done.
My next question is for Dr. Wang, and you've talked about wearing that mask and face coverings. With phase 1 happening, is there talk about making more directives on wearing masks, like perhaps making them mandatory for grocery stores and other type settings where people have to go to?
No, not at this time. We're also awaiting provincial guidance on the masking issue. But what I am seeing here in the region is obviously as restrictions are lifted and more stores are opened, etc., people will be out more. And what we've noticed is that sometimes people don't do the physical distancing, and so for that reason, I really encourage everyone who is going to be out with other people because it's very possible that when there's other people, physical distancing isn't able to be maintained. And in those cases, I recommend that people wear non-medical masks, such as cloth masks or face coverings, if they can.
I have one last question. Community spread, we're still seeing a bit of an uptick since May 6th. There have been a few days where there are more community cases rather than long-term care settings in terms of new cases. What is your modeling suggesting? Has community spread peaked, or should residents still be concerned?
I think we have to look at it at not only the day-to-day fluctuations, because there's gonna continue to be day-to-day fluctuations. I think we need to look at the trend, and when you take a look at the, I'm just gonna see if I can pull this up. Okay, just quickly see if I can share my screen so that people can see. So if you take a look, I'll share my screen. Share screen, right, okay. So if you take a look here, this is our epi curve, and the community associated cases are in dark green. So as you can see, there isn't an increase. There's day-to-day fluctuations. It's remained. It's lower than it was initially in the earlier part of our first wave, and it's still relatively controlled at this point, and even as well. So I think that's kind of the best indicator, the overall trend over days, and not the day-to-day fluctuation. So I hope that helps.
Yep, that's it. Thank you.
Thanks, Nicole. I will pass it over to Julianne. Can you hear me, Julianne?
Yes, I can.
Okay.
Yeah, great. Thanks. I guess my first one is just, I just wanted to clarify with Dr. Hsiu-Li Wang, what you were saying about the OLIS issue. So is that the lab results were not being recorded through the system?
Yeah, so what it was is, well, this study, the ISIS study, they pulled their numbers from a database that isn't used by public health. It's used by the lab system called OLIS. And what we understand is that, as the lab system was being built and labs were being added to the lab system in the last weeks, there were labs, and there still, I understand, are labs that are not inputting their data into OLIS. And some labs started to input later on, we don't know when. And so OLIS doesn't have all the results of specimens that were processed from Waterloo region. And based on the information we have to date, based on what we've discovered to date, there's a significant undercounting in Waterloo, in the OLIS database for tests that have been done in Waterloo region. And so it's a database that has incomplete data for Waterloo region, and it's difficult at this time to understand what exactly accounted for the difference when, I should probably simplify that. What we do know is that there's a significant number of tests that were performed in the region that were not in the OLIS database. And we know that because they published results as of April 30th that were significantly different from the results that we had. So already there's an indication that there was data missing then, and there still could be data missing now, because we don't know, what percentage of the samples that were done in our region are actually showing up in OLIS now. We think it's improved because we understand more labs over time have started to put their data into OLIS, but we're still not 100% sure.
And just to jump in there, why is that important for it to be like recorded in that database set in particular?
Yeah, because it's being used to compare health units to each other.
And so
yeah, so there are regions where we've heard from colleagues, oh, that pretty much mirrors what we had. In our case, no. So it's not an apples to apples comparison at all when you have an incomplete database that affects certain regions disproportionately.
Yeah. And so is it rectified then at this point, or it's no, it doesn't seem to be?
No, we're still, I mean, this was a study that was done by researchers who pulled from this database. So we are currently in communication with those that are involved in the study, as well as Public Health Ontario Lab, because they oversee the lab system and the lab databases, to make them aware of these discrepancies. And I understand that they're looking to, make adjustments, make sure that the data going forward is more complete. But this is something that, probably is going to take some time. And I'm sure that since we've notified them of these issues, they're going to want to make sure that the data quality is better going forward.
Mm-hmm.
But this is something we discovered as well. Like the data were published, and then we had to go back and look at it and see what happened. Why is it so different from the numbers that we have?
And how different are the numbers? Are the numbers that you have then higher?
Yeah. So I'm just going to pull up my notes. Hold on a second. I'm just having an issue with the notes here, but it's roughly about 25% of our results that are missing, roughly. And this is based on the data we have at this time. Yeah.
Okay, thank you. Just another question. I think this would be for Karen Redman. With Dr. Hsiu-Li Wang talking about how discouraged she was seeing people not physically distancing this weekend, and Mike Murray talking about that, I guess the number of visits this weekend and calls. I mean, is the region, I know there are measures in place now, but will it consider more measures as things continue to open up?
So Julianne, I guess I'd answer this way. I mean, one of the reasons why we declared a state of emergency at the region was so that we had extraordinary powers if we needed them. Currently, what we still, our first plan of interaction is education and compliance. We do have the tools to charge people. It's a $750 charge. Those charges have been laid. We still have bylaw officers at the area municipalities at the region, as well as public health inspectors and Waterloo Regional Police. So if we need to escalate this, we will. The reality is, I don't think you could ever hire enough bylaw officers or police officers to make everybody comply. This really is about a partnership of the community investing in the greater good, in following social and physical distancing, because we know that that stops the virus from spreading. So we continue to go forward hoping that people will continue to put other people's health ahead of their own frustration with having to live in these constrained environments.
Okay, and just last question for Dr. Wang again. I'm just wondering, obviously public health has kind of been in an emergency response mode over these last couple of months with talk of, different businesses going back to work. I guess when will public health perhaps be resuming some of its normal activities and, doing that as well?
Thanks for the question, Julianne. So we are still very much in the response mode to the pandemic, very, very busy. We still have critical services in public health, other types of critical services that are running. The priority still remains, besides those other critical services, to focus on the pandemic response. As you may be aware, the government wants to make sure that the public health measures are strong in order to be able to continue to maintain transmission at a controllable rate. So that's what we're going to be focused on. And actually, your question just allows me an opportunity to just make something clear, because I see my inbox is having questions. I'm getting questions about this. So I just want to make something clear about the long-term care home and retirement home testing. So the province directed that all long-term care homes across the province have what's called whole home testing. So this is testing applied to the entire home, all staff, all residents. So Waterloo region, through our partners who actually do the testing, met the deadline, met the directive. All the long-term care homes in our region have gone through whole home testing. In addition, what I had recommended as the medical officer here, and I know some other places have done this as well, I wanted to see whole home testing of retirement homes as well. There was no provincial directive for this, but what we have done with retirement homes is we've done the testing of the homes, all the whole home in priority order. So we started with the homes that were in outbreak. I'm talking about the retirement homes. We started with the homes that were in outbreak, and we are continuing to make our way through the other homes that are not in outbreak, for instance. So, and we're going to continue to do that testing over the next few weeks. So I wanted people to know that. I know there has been some confusing messages. I think because, there's been, because the provincial directive only applies to long-term care homes. And sometimes some regions, such as ourselves, have decided to test more than what is in the provincial directive. So the testing of retirement homes that involve the whole home will continue over the next few weeks.
Okay, yeah, and that's it for me, except I just have one really quick point of clarity just to ask. Just
Sure.
going back to the OLIS, did you guys discover that like within the last week? Or I know you said you discovered numbers like going back to April, but when did you guys discover that?
Well, when the results were released publicly, and then there were, media articles about us, how we ranked compared to others. We looked into that because the numbers didn't match our numbers. And then, so we started looking into that with Public Health Ontario and the researchers. So that's when we did this work over the weekend.
Okay. All right, great, thanks.
Thanks, Julian. I believe the last question is from Kevin Nielsen. Go ahead, Kevin.
Thanks. So was there a large influx of people seeking tests this weekend that wouldn't have been allowed to before, kind of thing?
Yeah, so I actually don't have the latest numbers. Again, it would be the testing sites that would be able to provide you with the latest. But I've heard some anecdotal information that suggests that we still have room to take people in for testing. And so that's why I really want to pass the message out, especially since the testing opened over the long weekend and people could have been focusing on the long weekend. So I really want to get the message out that, our partners who do the testing have, made testing now available for all those who have symptoms of COVID-19. And, in addition, we have that tool that you can access through our website where people can not only do the self-assessment, but then be connected to either their primary care provider virtually or another primary care provider virtually in order to be assessed. And then these providers can provide a referral for testing that way as well. So with it being relatively new, I just want to help. I just want to, make sure that the message hopefully gets out that it is now opened to testing for all those who have symptoms of COVID-19. People can do the self-assessment on our website. People can call their family doctors, and just to encourage people who have symptoms of COVID-19 to get tested.
Okay, thank you.
Okay, nothing further, Kevin?
No, not for me.
Okay, have I missed anyone, or does anyone have a final follow-up question? I saw Damon's hand first, so go ahead, Damon.
Okay, so this is for Dr. Wang about the retirement home testing. Will this include the smaller, like individually owned operations, and will it be a requirement for people in those facilities?
No, it's not a requirement. That's because it is not done for the purposes of outbreak management, for example. It's done to get an assessment of the entire home. It's a one point in time assessment because it was required of long-term care homes. You know, and we do know that there are outbreaks also in retirement homes. I wanted to ensure that this was also available to all the retirement homes. And for the most part, when we offer it, the large majority take us up on that offer.
Will we see like a rise in cases due to this, or is nothing too significant, or what are you expecting?
That's a good question. Thank you, Damon. So what we've seen to date suggests that unless we have signs that there could be active spread, we're not generally finding many positive cases outside of those circumstances. So a lot of the whole home testing that we've done has come back with, you know, no positive results. Sometimes there's a case or two, and then in that case, you know, we would put in outbreak measures and things like that. But a lot of the times we're not finding cases where we didn't expect them, which is a good thing. But for now, these congregate settings, these long-term care homes and retirement homes are very vulnerable. And that's why there are still measures in place to really be, very strict on when we actually consider them under outbreak, and the measures that we put in place to try to prevent cases from entering the home. This is something that we're going to have to continue to watch. And as I've mentioned before, what happens in our community affects what happens in our homes, right? Because these are relatively closed settings, right? The residents, that's their home. And if there's more community transmission, we can expect that leads to more risk for our homes. And so it's something that we have to continue to be very vigilant about and try to keep community transmission rates low as well.
Okay, great. Thank you.
Thanks, Damon. Ben, did you want to ask a follow-up question?
Yeah, this is a question for Dr. Wang. I know you said anecdotally you've heard we have room. So that kind of makes me just wonder, are we going to be waiting for provincial guidance for sure to expand testing maybe to people who have come in contact with those who test positive? Or would there be a point where we have room would become like we would lead to that expansion even for a day or a weekend?
Hi, Ben. So thank you. So it's not just a question of room. It's a question of what's recommended. So if you do asymptomatic testing, you are actually testing, first of all, the test isn't as good on people that don't have symptoms. Second of all, it's a point in time test because you don't have symptoms. And so you could test negative and the next day you could get it. And so there are limitations to testing everyone. And so what the provincial experts have recommended, and this is guidance across the province, is that if you have symptoms of COVID-19, you should be tested. So it's not a question of lab capacity or local testing capacity. It's a question of following, guidance based on the best available scientific evidence for who should be tested. And so I just kind of wanted to provide that additional information. So the province is recommending that all those who have symptoms of COVID-19, are eligible for testing. We've made that available here in the region. And what I'm hoping to get out as a message now, and I'm hoping that, the press can help us as well, is to encourage all those who have symptoms of COVID-19, even if they're mild symptoms, even if they're just starting to have them, to contact their primary care practitioner, to go and get tested, because our testing rates and our ability to detect through testing are going to be largely dependent on people who go for testing. And so we want to encourage that as much as we can.
Thank you.
Okay, thanks, Ben. Last call for final questions. Doesn't look like we have any, so we can wrap it up then. Thanks for joining us. And just a reminder that our next media briefing will be on Friday. So we'll see you back here then. And thanks again for helping us share these messages. Have a good week, everyone.